Good afternoon, and welcome to today's webinar. My name is Dave Edwards, and I am Acting Director at OEHA. Thank you for joining us today for the sixth and final session of our Bridging Science and Action webinar series. OEHA launched this series in January at our Bridging Science and Action Symposium here in Sacramento as part of our efforts to track and report on climate change and its impacts on California. Since then, we have convened webinars on water, infectious disease, oceans, and much more. At each webinar, speakers present the latest scientific understanding on the featured climate change topic and provide examples of actions underway to address the impacts. These examples are a small fraction of the work across California to develop and implement sustainable, equitable climate change solutions. As many of you know, OEA publishes the Indicators of Climate Change in California report. Both the report's contents and the process to compile it demonstrate the importance of collaborations and partnerships in understanding and tackling climate challenges. OEHA convened these webinars with our state agency partners in that same spirit of collaboration and partnership. Each webinar is an opportunity to strengthen partnerships among OEHA, our co-conveners, and the organizations represented by the speakers. Each webinar is also a chance to learn about areas of climate science or action that may be new for some of you joining us today. OEA is grateful for these opportunities and for CalEPA Secretary Yana Garcia's strong support of the partnerships and learnings resulting from this webinar series. Today's webinar will address climate change impacts on our health and well-being from heat, wildfire, smoke, and air pollution. In California and across the U.S., heat causes more deaths per year than any other weather hazard, despite being the most preventable cause of weather-related deaths. We see emergency room visits and hospitalizations for heat-related illnesses rise on hot days. Last month, California's hottest July on record, a major heat wave during the first 10 days, is thought to have killed at least 18 people in Santa Clara County alone. Heat also affects our air quality. It speeds up the formation of certain air pollutants and traps them closer to the ground. And wildfires, fueled by drought and high temperatures, expose communities to smoke, even in areas far from the fires. The triple threat of heat, wildfire, smoke, and air pollution disproportionately impact vulnerable populations and underserved communities. OEHA is proud to support the scientific understanding of climate change impacts on health and actions we can take. Our scientists research the health impacts of heat and identify populations vulnerable to these impacts. You will hear from one of these scientists, Mei Wu, today. OEA also houses CalEPA's Children's Environmental Health Center, collaborating with programs across the agency to promote policies to protect children's health, including those from the impacts of climate change. We are now developing an extreme heat ranking system on behalf of CalEPA. This tool, known as the California Community's Extreme Heat Scoring System, or CalHeat Score, will forecast heat waves, help people prepare and plan for extreme heat events, and provide information about local resources. We would like to thank our colleagues at the California Air Resources Board and Department of Public Health for planning and convening this afternoon's webinar with us. We have a full lineup of speakers who will discuss the health impacts of climate change from heat, wildfire, smoke, and air pollution, and examples of tribal, state, and community actions to address these impacts. I'll now turn it over to Carmen Milanes to discuss the rest of the program. Carmen.
Thank you, Dave. Good afternoon, everyone. Thanks again for joining us. I'm Carmen Milanes. I'm program lead for the Climate Change Indicator program at OEHA, and I want to acknowledge the rest of the indicator team with me this afternoon. Tamara Kadir, Lori Montserrat, Emma Tanner, and Annika Alexander Ozinskas. As Dave mentioned, we are pleased and really thankful to co-host this afternoon's webinar with the California Air Resources Board and the California Department of Public Health. Before we begin, just a couple of notes on logistics. We will hold questions until after all of the presentations. We have set aside some time at the end of the presentations to address questions verbally. We do have a Q&A panel. Please use that if you'd like to type in a question. We have invited our panelists to respond to questions as they're able to. And also we will get to some of your questions at the end. As I noted earlier, if you do want to speak, we ask that you raise your hand during the Q&A portion of today's webinar to request to be unmuted. With that, it's my pleasure to introduce a colleague, our first speaker, Mei Wu. Mei is a research scientist in the Air and Climate Epidemiology section of OWIHA with more than 20 years of experience in environmental health-related research, focusing on air pollution and heat exposure. She is a trained exposure scientist with a PhD in biomedical and health science from Rutgers University. Her current research focuses on cardiovascular and respiratory health effects associated with criteria air pollutants and climate-related factors. Mei?
Thank you, Carmen, for the introduction. It's my pleasure to be here. I'm going to give you a quick overview of the impacts of climate change on human health. I'll begin with this figure from the 2022 California Legislative Analyst Report. This figure shows 3 major climate stressors and 5 resulting climate hazards present in California. We have discussed the sea level rise at the last webinar, so my talk today will focus on health impact of heat and wildfire. First, let's start with heat. As we know, global temperature had been gradually increasing over time. This figure shows temperature anomalies compared to the 20th century average in California. As you can see, temperature getting hotter and hotter in recent years. 8 of 10 warmest years on California record have come in between 2014 to 2023. Under this circumstance, heat waves become more frequent, long-lasting, and intense than they used to be. As Dave mentioned, July 2024 has been confirmed to be the hottest month on California's record. The average temperature across the state surpassed the prior record from July 2021 by almost 2 degrees. Such extreme heat event caused lots of deaths and injuries in California. This figure shows the heat-related hospitalization and emergency department visit per 100,000 population in California. Take 2022 as an example. There are 39 million California population in that year. 130 per 100,000 rate means almost 51,000 heat-related ED visits and 8,500 hospitalizations statewide in that year. 2 months ago, California Department of Insurance published a report assessing the insured and uninsured cost of heat. This report examined 7 extreme heat events in the state from 2013 to 2022, and these are the results they found. The report noted that these numbers are likely to be underestimated. Research has linked the heat and the health effects of nearly all the organs, more than heat-related disease that we usually think of. Human body responds to heat stress by dilatation of blood vessels in the skin, which brings more blood to the skin surface to dissipate heat by radiation and sweating. This process will increase the cardiac output, increase blood viscosity and coagulation, and divert blood from heart and vital organs. Extreme heat could damage epithelial membrane. Endotoxin could leak into the system circulation, causing systemic inflammation. These can further cause organ, tissue, and central nervous system dysfunction. Epidemiological studies among California population have found the increase of temperature was associated with increased ED visit and hospitalization of all kinds of diseases listed here, like acute renal failure, hypotension, and intestinal infection. Extreme heat can exacerbate underlying health conditions, including diabetes, asthma, and cardiovascular diseases. In addition, recent studies find that heat can increase mental stress, impair cognitive function, and even increase violent acts. For people who are pregnant, heat exposure can divert blood from the uterus and inhibit fetal growth. Dehydration from heat exposure may also decrease uterine blood flow and increase secretion of oxytocin, which can induce labor prematurely. Some population subgroups are more sensitive to heat exposure due to physiological reasons. This includes elderly people, infants and young children, pregnant people, people with chronic medical conditions, and people who take certain medications, including beta blockers, blood pressure medication, and antidepressants. These populations may have a higher threshold for sweating and reduce the ability to dissipate heat. Lack adaptive capacity can also make people subject to higher risk. This includes people living in areas unaccustomed to extreme heat, like the coastal areas. People lack access to air conditioning or cool spaces, including people unhoused, and people who are socially isolated, people who have a language barrier, make relocation and access to healthcare more difficult. Lastly, vulnerability also comes from exposure. This includes outdoor workers in industries like agriculture, construction, and delivery service, and those who work in hot indoor environments that lack adequate air conditioning. Athletes, hikers, those who spend lots of time outdoors are also subject to higher risks. Next, let's move to health impacts of wildfire smoke. Wildfires emit a mixture of pollutants, including particulate matter, carbon monoxide, natural oxides, and toxic carcinogens such as benzene and benzopyrene. Depending on the materials burned, heavy metal like lead and mercury can be emitted as well. Wildfire-specific PM likely has a different toxicological profile from PM originated from other sources and can be more hazardous than ambient air pollution. Here, I'm showing two studies published this year. This map shows the estimated PM 2.5 generated by wildfires across California for the period of 2007 to 2018, which contributed to up to 5 microgram per cubic meter long-term average PM 2.5 concentrations. The recent big fires were not included in this study, otherwise this number could be even bigger. Early this year, US EPA tightened the National Ambient Air Quality Annual Standard to 9 microgram per cubic meter, which means above that level, long-term health effects may appear. Here, in some places of California, wildfires already contribute to a significant amount of PM exposure. A UCLA team investigated wildfire smoke and mortality. They estimated more than 50,000 premature deaths were attributed to wildfire PM 2.5 over the 11-year period, equivalent to an economic impact of more than 400 billion. This figure is cited from a recent review conducted by researchers from Stanford University, summarizing the health impacts of wildfire in 6 aspects. Besides direct damages, mental health and the respiratory outcomes have been linked to wildfires with high confidence. Evidence on cardiovascular effect has been mixed. Some studies found significant association among elderly people, but not the overall population. Our section published a paper this year found that wildfire smoke was associated with increased risk for cardiovascular emergency department visit at lag 10 days, suggesting a delayed response for cardiovascular outcomes. A growing number of studies have linked wildfire smoke to adverse birth outcomes. Researchers from UC Berkeley and UC San Diego that we mentioned in the last slide investigate 5 million live singleton births in California, and found that exposure to higher wildfire PM 2.5 exposure average across pregnancy or any trimester was associated with high odds of preterm birth. And research on other health outcomes are still accumulating. Next, let's move to the compound effects of heat and wildfire smoke. The co-occurring of heat wave and wildfires become more often in California in recent years. Both hazards have increased in less intensity and size and the climate change, creating more overlap. People who are vulnerable to heat are usually subject to higher risk of wildfire as well. This figure is from a recent study by the researchers from Scripps Institute. It shows the number of co-occurrence of wildfires and extreme heat across the state between 2009 to 2019. As you can see, the co-exposure happened more frequently in the northeast part of the state. Again, this didn't include the recent year record, so the current number could be higher. These researchers investigated the compound effect between extreme heat and wildfire smoke on daily cardiorespiratory hospitalization in California. This figure shows the odds ratio of the individual exposure and the co-exposure. The joint effects of co-occurring exposure was much greater than the individual exposures. They also identified the disparity of such compound effect, mainly related to low income, low education, dense housing, and less access to health insurance. Another recent study by UC Mercy researchers found greater risk of preterm births among those who are exposed to wildfire smoke and heat simultaneously. I will leave this other air quality related health impact to my ARB colleagues. Okay, today's takeaway messages. First, heat and wildfire smoke impact more aspects of human health than we traditionally think, including mental health and birth outcomes. Second, exposure to co-occurring climate hazard creates actual stress and challenges for human health, as we see their health impacts are synergistic more than additive. Lastly, awareness is the key to prevent the health impacts, especially among population at risk. Usually people think they are healthy, so don't perceive that they are vulnerable due to their age, health condition, or the activities they do. Knowing about the risk will motivate people to take actions. This concludes my talk. Thank you for your attention.
Thank you so much, Mei, for that overview. It nicely sets the stage for the rest of the talks to follow. So for our next speaker, we are honored to have Miguel Angel Luna. Miguel is the Chief Administrative Officer of the Fernandeño Tataviam Band of Mission Indians. He serves many roles. Examples include as an executive advisor to the tribal president on policy and departmental activities. He is principal administrative advisor to the tribal senate on matters related to the tribal historic and cultural preservation. And I'll just stop there. He has a list of other other roles that'll be in the chat. He also serves on many organizational and state boards focusing on water protection, youth education, open space, conservation and access to the outdoors, environmental justice, and empowering underrepresented and under-resourced communities. With that, Miguel, please.
Thank you so much, Carmen, for the introduction. And thank you, Mei. I think you teed up for me well who we are trying to protect by our actions at the tribe. And I think David Edwards really teed up the geographic areas and the reasons why we're engaged in this work around climate. So for the tribe, of course, tribes have been living with nature and interacting with nature and finding solutions along with nature for time immemorial. Current times requires us to adapt to include also science and strategies and policies and even politics to be able to engage properly and bring the resources necessary to where they belong. In the hands of the people who are being impacted and have a role in making things better for themselves and others. I say this because we use this analogy of almost of the dragonfly, where the dragonfly, in order to seek its prey, it predicts where that prey will be within a projection of time, and then it makes that projection towards that prey. Similarly, the tribe has embarked on, we know we're in a climate change where this is not debatable, at least not for us, and it shouldn't be for others. What we're looking for is where are the resources, not today, which we know where they are, but where will they be in 5 years and in 10 years? And what are the issues that will be impacting us in 5 years and 10 years, and start building a roadmap towards that. So the tribe embarked on a 2-year process to create this tribal climate resiliency plan with that vision, to be able to assess how tribal citizens were being impacted, where they were being impacted, and along the community within the territory that the tribe oversees, and to come up with recommendations that were actionable. So that's what I'm walking you through. This presentation will live on the website, so you'll be able to look at the QR code and download our plan. To give you a little bit of orientation, we are in Southern California. We're about 2,000 acre miles of territory that the tribe overseas, in the valleys of Simi Valley, San Fernando, Santa Clarita, and Antelope Valley. Those are the areas, and it's an area that's very arid. It's an area that can get very hot, and as you'll see in our data, that is indeed what we found. We knew going in from issues that and data that had been collected prior by LA County and other entities that heat was an issue, that flooding was an issue, that drought was an issue, and that wildfire was an issue. And these are issues that pretty much cut across the region, the state, and across the nation. If we're not looking at these, not all of us are impacted by all of these things. It just happens to be in the tribal territory, these are the things that are impacting us collectively and cumulatively. So it's going to get hotter, that's for sure. And the days are going to be, there's going to be more days of heat and longer days of heat. And the issue of drought in Southern California has been one that we've been grappling for a while. And of course, wildfires, we've seen it in past, I think 4 years ago. We were hoping that this year would be one that you don't have to deal with so much of those issues, because it's not just about property and wildlife and the landscape, but it's also about the smoke and where it carries. And we know that we can enjoy living next to Angeles Forest, but when those forests catch on fire, then we take the burden on of pollution. So our report goals was to build a resiliency plan, to build a blueprint for ourselves on how we would work towards finding resources and solutions and actionable plans. We wanted to collaborate with neighboring tribes. We wanted, one important part for us was to marry our traditional ecological knowledge with modern science. And that's what you see below, all the partners that assisted us in bringing this forward. Of highlight, extreme heat has been mentioned before. In our territory, it's scheduled to be, upwards of 4 degrees. Some areas even 10 degrees hotter. And that means different things happen. Some of the things that were identified is blackouts, as well as there's energy push. That was a new finding for us, that people were very concerned about how they weren't going to have energy during the times when it was most needed, which also impacted people that are on ventilators, people that require energy to live on a daily basis. And of course, we talked about wildfires. And as it's been mentioned before, high temperatures will worsen respiratory illnesses. We love using maps and data, and our partners have been the ones that have brought that as value to us, to work together towards really analyzing that. And these maps really presented a picture for us on where we needed to take action. We also found that there were higher numbers of visits to the emergency room in our territory, and there were higher cases of asthma that were further exacerbated by higher temperatures and, of course, by smoke due to wildfires. But, those are the things that we've been grappling with. I want to leave you with where we're headed, because a blueprint provides a map, but we really want to make sure we work towards actionable items. So using the science, and I think today's conversation is very ideal of bridging science, and I'd add to that indigenous science, Native American science with the action. We came across 3 cross-cutting climate hazard recommendations. One were cooling centers, which are going to be very much needed. Continue to conserve our streams, And of course, this backup of energy that's going to be required. You know, I don't have to say that, I don't have to remind people that during COVID, a lot of the issues of those people who were already burdened took a higher burden because of it. And we can't stop now. We got to continue to protect those who are most vulnerable. Our citizens are in the crossfire of what's coming and what we're in the middle of. And so we're really taking action towards that. We've been very strategic in pursuing grants, in particular, too, with the Strategic Growth Council. We've been very blessed to have been awarded a technical assistance toolkit development grant, so that as we learn how to work better together with other entities, that we develop a toolkit so others can access it as well. We received a grant to do a planning exercise, well, actually a planning grant towards implementation for climate resiliency centers. We're working on a greening fields program to plant 750 trees to mitigate heat in our territory through the IRA federal funds. And we have established, in partnership with UCLA, a climate ambassadors program to educate people about the dangers of climate, and also what can they do, what actions can they take towards that. One thing that's not here is we're looking towards the future. There's a romanticism that happens with tribes of talking about the past of tribes, but just to remind everybody, the tribes are here today. They will be here tomorrow and thousands of years to come in the future. And so that means we established a tribal conservation corps that are the actual implementers of some of the workforce projects that were put together. They'll be the ones actually planting the trees. So I wanted to highlight that as well. I'm going to leave you with 3 points. Please, number one, engage with tribes. It is essential that you do so. They have the knowledge, they have the willingness, and they want to work with everybody. So please reach out. If they say no today, that's okay. Try tomorrow. 2, collaboration and partnership with data-driven organizations is a huge, valuable toolkit. They have it, especially partnering with entities that share your values, like for us, Climate Resolve, Council for Watershed Health, entities that really understand the importance of engaging with tribes and why this data matters. And state and federal agencies as partners really presents really great opportunities. That's where we're going after for the serious funding that's needed. The funding we have today, the $10,000, the $20,000, $100,000 grants, we can't use those anymore. We need multi-million, multi-year grants. So we're very thankful for the opportunity to be able to present here and speak with all of you and share our story, and that we're in this together. So thank you so much, Carmen, for the invitation. Thank you, David Edwards. Really appreciate it.
And thanks so much, Miguel. We do recognize the value of tribal knowledge, and we know that it will be essential for us to better understand the climate change issues confronting us. And we have a lot to learn from tribes about your practices in terms of building resilience and taking action. I really love the comment and the encouragement for us to reach out to tribes, and we are doing that and we'll keep doing that. And I love your follow-up. If we get a no, we'll just keep trying. So we will certainly heed that advice. So going back to our state partners, our next speakers are Bonnie Holmes-Gen and Barbara Weller from the California Air Resources Board. Bonnie's the branch chief for the Health and Exposure Assessment Branch in CARB's Research Division. That branch focuses on health research and health analysis to support the board's clean air mission. She previously worked at the Department of Toxic Substances Control and was the Senior Director for Air Quality and Climate Change for the American Lung Association. Speaking with her is Barbara Weller, who supervises the Climate and Health Analysis and Library section in CARB's Research Division. That section is involved in conducting and sponsoring critical research on how ambient air pollution, climate change, and inequity impact the health and welfare of California's vulnerable communities and sensitive populations. So, Bonnie and Barbara?
Great. Thank you so much for the great introduction. And my colleague Dr. Barbara Weller and I will be presenting CARB's path to carbon neutrality, important health benefits of taking action to protect the climate, and benefits and resources available to support the transition away from fossil fuels. Next slide, please. CARB is charged with protecting the public from the harmful effects of air pollution and developing programs and actions to fight climate change. California has pioneered a range of effective approaches that have set the standard for effective air and climate programs for the nation and the world. As we know, and we've heard in the previous discussion, the health impacts of the climate crisis are already being felt by Californians, with serious health effects projected to only worsen in the coming years without concerted action. These impacts are the focus of CARB's programs and research, and you can find out more about the many climate impacts pictured here in our 2022 scoping plan and our public health appendix that we'll talk some more about in a bit. Next slide, please. Climate and air pollution are very closely linked together. Climate change brings weather conditions conducive to ozone formation, including higher temperatures and stagnation events. Increased heat, in turn, increases the production of harmful air pollutants like ozone. Increased pollution leads to illness, especially in sensitive and vulnerable groups. With a warming climate, reducing air pollution becomes more challenging. Next slide. CARB-sponsored research and other studies have documented the effects of heat events on worsening ozone episodes. The number of days over 90 degrees Fahrenheit is one way of measuring potentially harmful heat in urban settings. On this slide, the graph to the right shows a clear relationship between increasing temperature and increasing maximum 8-hour ozone levels. These measurements were taken in Fresno, and it appears that with no action, the average number of days per year with the heat index above 90 degrees Fahrenheit threshold would increase by 60% from a historical baseline. Next slide, please. Some of you may have heard the term climate penalty. Because higher temperatures lead to more smog, and because California is more likely than elsewhere in the U.S. to experience higher temperatures from global warming, climate change could reduce the effectiveness of the state's air pollution control efforts. This effect is what we're referring to with the climate penalty. On this slide, you can see the results of a UC Berkeley study of 4 California air basins. Researchers modeled the projected emission reductions in these California regions with and without climate effects. On the left are the ozone reductions without climate effects, and on the right, we see with or including climate effects. This study shows that our programs to reduce emissions can be set back by the increase in pollution due to climate change factors. Other studies have also demonstrated these effects at the national level. All this means that climate change could make ozone standards more difficult to attain and maintain, and this needs to be taken into account in future planning. Next slide. The next 2 slides are a reminder of the serious health impacts that Californians face due to our heat impacts, and these were covered, of course, very well by Dr. Wu. Heat impacts affect our population at every stage of life, from childhood to seniors, with vulnerable population groups being at even greater risk. Just as with pollution, all these impacts are elevated in vulnerable populations that are pictured on the next slide. Next slide. Across our agency, CARB is working hard to assist vulnerable groups that bear the brunt of air pollution and climate impacts. And I'll move on since we've covered this in Dr. May's presentation, but there's a list of many of the vulnerable groups affected by heat. Next slide. California has a plan to combat climate change, and this is our CARB scoping plan. The scoping plan is a path to decarbonization by 2045 that also provides substantial health and economic benefits. The 2022 update to the scoping plan will cut pollution by 71%, as shown on the right, decrease greenhouse gas emissions by 85%, and result in a substantial increase in new jobs and huge health benefits. The health benefits of the scoping plan can add up to more than $200 billion in reduced hospitalizations, illnesses, and deaths. Next slide. Our 2022 scoping plan charts a path forward that includes two key components, as on this slide. One, in the first bullet, is the reduction of the use of fossil fuels and the increase in clean energy technology. And the second is our nature-based solutions and land management activities. And both of these are critical to the path forward. We're proud that the 2022 scoping plan is the first plan to fully incorporate nature-based solutions into our climate future. Next slide. There are many key actions that are needed to accomplish California's ambitious plan, and many of them are listed on this slide. We will need dramatic increases in new technologies such as zero-emission vehicles, and similarly dramatic increases in forest and ecosystem health. It's important to look at all the health benefits of taking these actions and of moving forward in this ambitious strategy. So I'm going to move next to Dr. Barbara Weller, who's going to speak about our qualitative assessment of health benefits in the scoping plan. Barbara.
Thank you. So in the scoping plan update, we conducted a qualitative health analysis to demonstrate the many additional co-benefits of CARB's plan for decarbonization. And we focused on 8 social and environmental pathways that affect health outcomes. The goal of the qualitative analysis was to evaluate these areas for health trends and impacts, and we looked at the no action or business as usual scenario compared to the take action scenarios under the scoping plan. Next slide. So we're basing our health impacts on review of the literature and the results of studies that show the impacts of these pathways on health. And we then show how a carbon neutral future will have additional benefits in all of the different pathways. We also need to think of ways to be sure that all communities in California benefit, including our vulnerable communities. So there is an area specific for that. Next slide. So let's talk about some of the different areas of concern. Many of our the scoping plan looked at the health of our forest, and this is a major concern due to reducing the risk of wildfires. The programs in our scoping plan that focus on natural working lands management will result in reduced risk of wildfire and substantial reductions, as you see here, in health outcomes and health cost savings. Next slide. Increasing the health of our forest can result in a 10% reduction in wildfire-related particulate pollution and an overall $3.1 billion reduction in healthcare costs. Next slide. We also work with other agencies to increase transportation options, and this can have a substantial health benefit, as well as reducing our dependence on fossil fuels. Increasing active transportation to 23% by 2050 through a mix of changes in land use planning and increased transportation options can result in impressive health benefits, as you see here. Next slide. So the scoping plan is a pathway to health as well as decarbonization due to the many co-benefits of our programs. The programs in the scoping plan will help our communities to prepare, recover, adapt, and withstand the impact of disruptive events, including climate change events. Resilient communities are healthier communities, but we need more information on the impacts of climate change on health. So we have an ongoing research program that is important to provide the scientific knowledge to measure improvements in health. And I'm going to turn it over to Bonnie to talk about our research program and other programs.
Thanks so much. And CARB has an ambitious research program to provide the scientific foundation for all our air quality and climate work. And we are inviting everyone to join us in this work by submitting research concepts and ideas for both our annual and 5-year strategic research plans and staying up to date on CARB research through our website. And we'll get some, we have some links in here in the chat about our research planning. Next slide, please. Climate and health questions are an integral part of our CARB research program, and we are funding work to better understand the health impacts of wildfire smoke, to understand the health benefits of increased greenness and how we can increase those benefits in overburdened communities, to understand the impacts of heat adaptations on the health of communities, and to generally understand climate impacts in vulnerable communities and to focus in on communities of concern. Next slide. Many communities are asking for more information on the health effects of combined exposure to multiple climate stressors. So we've started a research project this year to help answer this question. What are the most dominant and impactful climate stressors on health in different regions of the state? How have effects from these climate stressors impacted racial and ethnic subgroups? We're going to be answering many of those questions in our research. And if you want to receive updates on this project, please let us know. Next slide. We also get a lot of questions about what resources are available to help reduce climate effects in communities. CARB's Community Air Protection Program works with communities to help reduce air pollution risks and increase resiliency. There are several funding programs mentioned in here, but I'm going to highlight the third one, the community air grants that are available through the California Air Resources Board to support projects that promote clean air and increased community health. And over the course of our community air grants program, we've awarded $35 million to over 60 community-based organizations and 8 California Native American tribes. Over 100 projects, and there's $15 million available in this next cycle. And I think we have some links in the chat about the Community Air Grant Program. And there is a workshop later today on that program and next steps and for the next funding cycle. And finally, I wanted to we're celebrating the 10-year anniversary in the next slide, the 10-year anniversary of our California Climate Investment Program that has invested over $11 billion in funding through 24 state agencies to support the state's work toward equitable climate solutions. The program supports low carbon transportation programs, affordable housing, forest health, and community air protection. Over 1.7 million was invested in 2023 alone. So hopefully that helps everybody understand that there are significant and very important steps forward that we're able to fund through California greenhouse gas programs. So the next slide is our research division contacts. Hopefully we've given you a very strong understanding of our ambitious climate plan and the tangible steps we're taking forward and the funding that's available to support and implement that plan and to support community action. We're excited about all these programs mentioned here. We hope you are too. Here are some contacts for questions or more information on any of these topics, and I'll turn it back to Carmen. Thank you, Dr. Weller.
Yay. Thank you, Bonnie. Thank you, Barbara. Lots of great examples to illustrate California's continued leadership in climate solutions, and really appreciate you condensing a lot of information into a 10-minute presentation. And it's also really good to highlight the health benefits of a lot of the actions being taken or directed at emission reductions. And speaking of health, we're going to turn it over to our colleagues at the California Department of Public Health, Linda Helland and Dan Wu. Linda manages the Climate Change and Health Equity branch at the California Department of Public Health's Office of Health Equity. Her 25 years of public health practice have focused on increasing health equity through policy changes to achieve equitable social, economic, and environmental conditions for all. Linda is honored to do work that combines her two passions, health equity and climate change, and she's deeply inspired by movements for racial and economic justice. Dan Wu will be speaking alongside Linda. Dan is the team lead of the CDPH Climate Change and Health Equity branch responsible for cross-sector collaborative efforts to advance California climate policies, planning, and programs that promote public health and equity benefits. Previously, Dan worked for nearly a decade in the areas of green buildings, urban and environmental planning, and sustainable design. Linda and Dan, it's all yours.
Thank you so much, Carmen. Thanks for the opportunity to speak with you all today. I'm coming to you from the land of the Pomo people in Northern California. I've really appreciated hearing the speakers so far. The climate crisis is the greatest global health threat of our time, but taking action to address climate change presents significant opportunities to promote and protect public health, advance racial and health equity, and strengthen community resilience across California. Today, we'll provide an overview of our approach to addressing climate change through a health and racial equity lens, along with a few examples of work across CDPH to address health and heat and wildfire smoke. Next slide, please. As a public health agency, we advance the Institute of Medicine's definition of public health as what we as a society do to create the conditions in which people can be healthy. As others have discussed today, while climate change affects us all, people experiencing inequities are usually hurt first and worst. Because the impacts are not felt equally, we approach our work through an equity lens, identifying and prioritizing communities facing inequities and disproportionately affected by climate impacts. We call this a climate, health, and equity in all policies approach. The data show that health effects of the climate crisis are exacerbated by structural racism. So achieving healthy, zero-carbon, climate-resilient communities requires addressing racist policies and power. For us, equity means working towards a fair distribution of power and access to resources. And this requires prioritized investment in communities facing historical and continuing inequities, which can then reduce vulnerability to harm from climate change. Summed up by community activist Genoveva Islas, it's about providing these communities with greater cash, capacity, and control. With that grounding, I will go into some of our projects, starting with addressing extreme heat. Next slide, please. We know that heat-related deaths are undercounted on death certificates, so we're working to better quantify heat-related deaths. Last August, our staff released a report that analyzed excess deaths associated with the September 2022 10-day heat wave. We found a 5% increase in deaths, or 395 more deaths than would be expected, with the highest increases in deaths among people aged 25 to 64, Latinx people, and those from the South Coast or Los Angeles region. Next slide, please. CDPH is initiating a syndromic surveillance program statewide, which involves getting near real-time data from emergency departments about conditions seen, including those associated with heat, smoke, and poor air quality. Only about a quarter of the approximately 328 emergency departments in California report data voluntarily at this time, much lower than the rest of the US. After receiving data from emergency departments through the CDC's BioSense platform, we at CDPH will synthesize, analyze, and display the data, including which populations are experiencing disproportionate impacts, and share it with local health departments and others to plan prevention and response activities, maintaining confidentiality of personally identifying information. The overall syndromic surveillance system development is being led by the Center for Infectious Diseases in CDPH. We in the Climate Change and Health Equity branch will tier off of that system to focus on climate-related conditions, and will perform analyses and share the data in dashboards. Now I will turn it over to Dan. Thank you.
All right. Thanks, Linda. So Dan Wu, he, him pronouns, joining from the Nisenan and Miwok lands, usually based in Sacramento. So turning over to some of our other project examples, you know, we recognize there are many useful tools available to address heat. And because of the time limitations for today, I'll just highlight one of our tools for identifying risks for and planning to prevent and reduce heat-related illness. the CDPH Climate Change and Health Vulnerability Indicators, or CHIVIs, for California, and their data visualization platform that we call CHIVIS, help define the scope of climate impacts and identify the populations and locations most vulnerable to those impacts, including for extreme heat. The indicators are grouped into 3 types. First, we have climate exposure indicators, including projections of future extreme heat. Second, we have indicators that speak to a community's capacity to adapt to these climate exposures, including, for example, air conditioning ownership, tree canopy, impervious surfaces, and transit access. And last, we have indicators that account for populations with greater sensitivity to these climate exposures, including children and the elderly, those living in poverty, and data on race and ethnicity, linguistic isolation, disability, and more. The single indicator tab for Tulare County, shown here, displays projected number of extreme heat days from 2040 all the way to 2060 by census tract, describes why this matters for health and who is most impacted. And last year, we stood up our Climate Change Local Assistance Unit to provide technical assistance to local health departments and tribes, including support for the Pala Band of Mission Indians to develop a tribal heat mitigation plan. And we also now have a local health jurisdiction community of practice to collaborate and share resources on climate change and health equity. In the last few months, we've held a couple of office hour sessions on heat guidance and communications. And we've also worked to develop a number of heat guidance documents, including the CDPH Extreme Heat Guidance for local health jurisdictions and community service providers, shown here. This guidance compiles resources, tools, funding opportunities, and local case examples into a comprehensive web resource of recommended actions for protecting populations at greater heat vulnerability, including those shown on this slide. A takeaway here is that much can be done to prevent heat-related illness and deaths in the near, medium, and long term, as well as at the individual, household, and community scales. This includes being informed about things like medications that could potentially affect your body's ability to cool itself, so individual measures and awareness information. Then you look at strategies at the household level, so looking at low-cost passive measures, for example, like fans and other cooling measures to stay cool for those who don't have air conditioning or can't afford air conditioning. Information on energy assistance programs, again, for lower income households, and community level solutions like increasing shade trees, community cool surfaces, and roofs. We also developed heat guidance for schools, which provides voluntary recommendations on protective actions school personnel can take to protect student athletes and others doing strenuous activities outdoors in the heat. I'll note there are specific heat safety requirements for high schools that have interscholastic athletics programs, and our guidance points to those deeper requirements. The CDPH schools heat guidance utilizes the National Weather Service's heat risk forecast, shown on the lower left, which provides a 7-day forecast of the potential level of risk for heat-related impacts to occur each day. The level of risk is illustrated by a color and a number, along with identifying the groups most at risk at that level and what heat protective actions you can take. And as Dave mentioned at the start of this webinar, our colleagues at OEHA, led by Walker Wieland and his team, are developing a statewide California-based heat ranking system called CalHeat Score, and that will provide similar forecasts as the federal heat risk tool that we're using for CDPH right now. But once developed, the CalHeat Score tool is aimed to be more tailored for our state's needs, including linking users to local heat safety resources and programs. And the initial prototype is aimed to be released in 2025. We released an interim guide to health equity-centered local heat planning as a template for local jurisdictions, including health departments. Creation of local heat plans and use of this document are not mandatory, but are recommended. We envision this content being integrated into a local hazard mitigation plan, general plan safety element, public health emergency preparedness plans, or other local planning documents. It can help facilitate partnerships between local health departments, offices of emergency services, and other local agencies. And this year, our team kicked off the Community Health Workers, Healthy Homes, and Healthy Families Weatherization Project in Tulare County, a collaborative project between CDPH, Kauai Health, the Association of Energy Affordability, or AEA, Proteus, and UC Davis. This project aims to connect farm workers and low-income Tulare residents with energy efficiency and weatherization services. For example, attic and wall installation and window replacement. And this is done through trusted community health workers to reduce health risks, reduce energy costs, and improve resilience to wildfire smoke, air pollution, and heat. So far, the program has trained more than 25 community health workers, and in-home visits and referrals will begin shortly. So with that, I'll pass it back to Linda.
Thanks, Dan. Next slide, please. As the leading climate-related killer, heat poses a danger to workers, including many low-wage earners, immigrants, and people of color. But heat-related illnesses and deaths are preventable. CDPH's Worker Heat Program in the Occupational Health Branch is collaborating with partners to create training and outreach programs and educational materials, which will cover heat illness prevention and response, workers' rights, and CalOSHA's new workplace regulation on indoor heat. Audiences include workers employed in restaurants, landscaping, warehouses, construction, bakeries, agriculture, and more. Next slide, please. The CDPH Environmental Health Lab is in the field right now on a combined air quality and biomonitoring study of wildfire smoke exposures and clean air solutions in farm worker communities called FRESCA. The study is a collaboration with the Central California Environmental Justice Network, Public Health Institute, CalEPA, UCSF, New York Department of Health, and Illinois Institute of Technology. Farm worker communities need solutions for both smoke and heat during wildfire events. Swamp coolers are common economical solutions for cooling homes, but unfortunately they pull in large quantities of outside air. The Fresca team created new do-it-yourself MERV 13 filter solutions to reduce smoke infiltration, and the lab staff are comparing to controls without filters, measuring PM 2.5, temperature, and chemicals and metals in particles, as well as doing urine measurements of chemicals, metals, and biomarkers of stress. Next slide, please. CDPH's Exposure Prevention and Education section partnered with trusted community-based organizations to conduct interviews of 176 farm workers and their families and 30 members of the deaf and hard of hearing community in the Central Valley to gain an understanding of past experiences during wildfire smoke events, what actions residents have taken to reduce exposure to wildfire smoke, preferred methods of communication, and concerns for future wildfire smoke events. The information from these surveys will help inform the development of CDPH's wildfire health plan and to advocate for considerations for communities at greatest risk for adverse health effects from wildfire smoke events. Slide, please. Staff in the Exposure Prevention and Education section are also developing an interactive curriculum for community health workers who are culturally and linguistically equipped to educate residents about the health impacts of wildfire smoke. The curriculum builds knowledge and skills for community members to protect themselves and their families during a wildfire smoke event, including how to read the air quality index, find information, and how to use existing tools. The curriculum includes a module on portable air cleaners and how to build a do-it-yourself air cleaner when the option to purchase one is not available. Thank you so much. Appreciate your time. Looking forward to hearing from Eloy as our finale.
Thank you so much, Linda and Dan. Appreciate all the information on CDPH's efforts at advancing the understanding of vulnerabilities to communities and also supporting local government and community organizations, which would be a great segue into our last speaker, Eloy Ortiz. He is the Special Projects Manager for Regeneración Pajaro Valley Climate Action, where he manages the Transformative Climate Communities Planning Grant, incorporating community leaders and residents' views about needed greenhouse gas reduction projects that will benefit the health and safety of residents in the Pajaro Valley. Eloy is also the lead of the Monterey Bay Area Climate Justice Collaborative, bringing together different stakeholders in the region. Eloy, microphone's yours.
Sorry about that. Let me get back to who we are. So, hi, everyone. Thank you. Again, my name is Eloy Ortiz from Regeneración Pajaro Valley Climate Action. I'm coming from you from the Amamutsan lands, also known as the Santa Cruz Mountains. Thank you for having Regeneración. My presentation today is called Documenting Climate Change in the Pajaro Valley, a Community-Based Approach. So a little bit about us before we get started. Our mission, as you can see, is to achieve climate justice through community-driven solutions. And the way we do that is to advocate for the most vulnerable populations in the Pajaro Valley, who are farm workers, who we've been hearing about and learning about how they are impacted specifically in our area by climate change, and advocating for projects and programs around climate change to be, for their voices to be included in projects and programs as they are being developed. As Carmen noted, we have a TCC planning grant, also manage the Bay Area Climate Justice Collaborative, and we were recently a partner on the National Oceanic and Atmospheric Administration grant to the Monterey Bay region. So for those of you who don't know, the Pajaro Valley is located in southern Santa Cruz and parts of northern Monterey County. It's a multi-jurisdictional area. Agricultural work is the main driver of the economy. It's especially berry production. So the local big corporations here are Driscoll's and Giant, but there's also blackberries, grapes, and nursery plants. There's a high Latino population, high immigrant population in the area. And in the past few decades, there's been a growing Oaxacan community. The Oaxacan people are indigenous Mexican people from the state of Oaxaca, which is located in southwestern Mexico. They've been coming to the Pajaro Valley for the past 2 decades. They speak various languages and dialects. The main one in this area is Mixteco, but other languages spoken include Triqui, Chatino, and Zapotec. It's not a written language, and many Oaxacans speak some Spanish or to little to no Spanish. So resources that have been developed for Spanish-speaking community are not developed for the indigenous language Oaxacan community. So I wanted to highlight a few of the climate change impacts that have been impacting residents of the area. So some of you may know that last year, March 11th of 2023, the town of Pajaro was flooded. And that led to 250 residential structures damaged or destroyed, which totaled $100 million. Damage to infrastructure, roads, water and sewage systems. Businesses and commercial structures were damaged, and the agricultural industry, where many of the Oaxacan residents work, lost $600 million last year. Previous to the flood, there were drought conditions here in the Central Coast, which left people who worked in the agricultural industry without work. Also in 2020, we had the CZU spot fire, so there was exposure to wildfire smoke that's been mentioned, with little to no PPE provided by employers of farm workers. So many of them would go out with just bandanas as PPEs to stop breathing the wildfire smoke. Also increases in heat events, and despite California state laws that say farm workers cannot work in extreme heat, there's a lack of safety enforcement by the state, and there's inconsistent self-regulation across large and small farms. There is also pressure from farm workers within themselves to not bring attention to the fact that temperatures are over the legal limit, because if the farm work shuts down for the day, they have no other recourse for making money. And of course, some of you may know, Central Coast, we have some of the highest rental prices in the country. And so given the fact we're in an organization that really wants to connect with all the community members in the area, to tell them about resources, climate change resources, and learn about how they view climate change impacts and how they're being affected, the question we ask ourselves on a regular basis is, how do we communicate information to all residents in an equitable manner? And one of the disparities that we saw develop immediately after the flood event is language access, language justice. How is information being communicated? How is that flood and recovery information being communicated to the indigenous language speaking farm worker community? And some of the strategies that were developed to address this language justice issues include developing a pipeline of multilingual interpreters. There are not very many, but trying to get them in a pipeline to be able to contract them for their services at community meetings. There's also been a growing reliance on video production to communicate information, including technical information. As an example, this is a video on YouTube, and I think I have the link available, where this press release from CalOES is translated into Mixteco for the Mixteco community. But some of the challenges with these strategies are that it's difficult interpreting technical information such as the CalOES letter. And also the information needs to be disseminated to the community still. And unlike a flyer that can be passed from person to person, these video links have to be communicated to people who have signed up for services at a local nonprofit. And they're usually sent out by text. So a phone needs to be available for use. Now I want to highlight a few ways that we are addressing language justice at Regeneración. We facilitate our climate justice collaboration meetings, both in English and Spanish, with interpretation available in both meetings. In both languages. So we start our meetings in Spanish and facilitate, and about the midpoint, we switch over to English facilitation. And the reason we do that is we want to make sure that our Spanish-speaking participants feel comfortable and feel like we are addressing their needs. Also, we work with presenters to develop our slide decks in both English and Spanish, showing information in both languages at the same time. I've been to many meetings for different jurisdictions where interpretation is provided, but slide text is not provided in both languages, or multi-languages, I should say. So Spanish speakers are not receiving the same amount of information that an English speaker is receiving. And I know that takes resources, but it's something we do to respect community members. We also partner again with indigenous language community leaders such as Mixteco community leaders to contract them for interpretation service, recruit indigenous participants for our projects, and develop video versions of our resources. We have, for our Strategic Growth Council project, we will create a video version of our final report to Strategic Growth Council in the Mixteco language. Another strategy that we use to address inclusiveness in engagement is using art and creativity to attract people who wouldn't usually come to a climate or environmental meeting. The pictures you see on the screen are of two separate events. The two on top are a jewelry making project, and the two on the bottom were a banner painting project. And so we market these events to community members and invite them to participate in them, hoping that the activities themselves will get them through the door. And so once they're engaged, once they're comfortable, we talk to them, learn about who they are, how they understand climate change in their lives, and what major issues they see that are impacting their families and their communities. And in a community like this, where a lot of people are below the poverty line, we listen to all the issues. These are not just climate and environmental focused talks that we have with folks. So, which leads me to our Pajaro Resident Photo Voice project. This was a project that we developed over the past year. This was a pilot project, essentially, where we recruited 5 Pajaro residents, 2 students from Watsonville High School, and one farm worker and one former farm worker, through a process where they took photos about climate change impacts in their lives, and wrote up some context for the photos. I will share a few of the photos, and the person whose photos I'm showing, they're all from one person, I should say. She is a trilingual farm worker who is looking to break out a farm work. And, these are little snippets that she's developed to tell stories about what she sees in her community. So, of course, this is as we were talking about farm workers and how they're exposed to environmental issues through their work, these are the long lines that people have to go through to get their fruit checked. And these are the same type of lines that were in Pajaro, where after the flood event, after people returned to their homes, they lined up for resources that were given out in the community. And so if you were in the area, you'd see long lines for different resources that were being given out. This particular photo really caught my attention. Again, there's just a lack of resources for many of the farm workers. As I always say, they don't come here with a U-Haul. They come with maybe a backpack, and so this is kind of a PPE that this person created for themselves. This photo about a weekend beach trip and the density, the population density at the beach on the weekend really reminded her of the population density in an area like Pajaro, where multiple families share homes and apartments. And finally, someone mentioned dust as an issue, or air quality is an issue, and air quality is an issue in Pajaro. There's a train that passes by and kicks up dust from the fields on a regular basis, and you can see this dust in people's homes and in local stores. So just again, vignettes about what life is like for people who are outside of the area. It's been almost a year and a half since the flood. So telling stories like these really highlight the long-term impacts of flooding and other climate change effects to the residents of the area. Also wanted to highlight that, we use resources, we use these projects to bring attention to the area. Inside Climate News, let me go back. Inside Climate News wrote an article about these photos. They're also being displayed at UC Santa Cruz in multiple places, and the Natural History Museum. And we use projects like this to continue the development of young climate leaders in the Pajaro Valley. And yeah, what I will say is we just try to be creative about how we engage with residents of the area and respect where they are and try to meet them where they are. There's my email address. One last thing, I am an author on the California's 5th climate assessment for the Central Coast region. If you're interested in connecting about including a piece for that report, please reach out.
Thank you so much, Eloy. There's a lot we can learn from the actions being taken by Regeneración, and hopefully our audience came away with some implementable ideas. Really great work working with, based on the intimate knowledge about the community you're working with. We have some time for some discussion based on questions that we have in the chat, and I'll start with that. I'd like to ask our panelists to turn their cameras on, please. Yeah, thanks everyone. Great talks. I'm going to start with a question about engaging community-based organizations and tribes. One question we have from our participants is, what are some organizations or mediums in which community-based organizations can engage with tribal leaders? So good to have Miguel and Eloy here, as well as our state partners. By which they can engage with tribal leaders and native nations on climate justice issues, and then specifically on tribal data autonomy or sovereignty. How do we balance tribal data autonomy and the importance of exposure science and evidence-based policy?
Yeah, I could go first. I think on the issue of partnering, I made it an issue that we don't, it's better if we partner on grants than try to partner on things without any resources. CBOs and tribes are already burdened with a lot of work in front of them. To try to take on an initiative because it seems nice or it's needed, but without resources, just it doesn't make any sense. Given all the money that's out there that the agencies are wanting to provide for these groups to come together, I've seen a lot of grants that require collaboration. So I think the funding, so for us, is someone's interested in working with particularly with I can't speak for all tribes, but with our tribe, is what sort of resources can we go after jointly? I think on the issue of data autonomy, we're grappling with that now, because we're trying to add more data to our existing data sets, and we're partnering with those folks that share our values and we have a closer level of trust with. However, when it comes to the cultural sites that we use for NAGPRA and CalNAGPRA that contains where our villages are, we don't provide a pinpoint of where a village is, because sadly, there's still looters out there, and as soon as someone finds out, they'll go out there and exploit those sites. So we're grappling with that now. One way is, we have NDAs, but there's certain levels of NDAs. So we gather all the data that we need, that we'd like to process or layer with our cultural sites and our villages, but we get all that ready before we actually have our plan is to have a on-site at the tribe, where those that need to upload shape files or create, if we're working with a cartographer to create a map, it's only as needed. It's not a, here's the link and use it whenever you want. So that's sort of, and then also some grants, they're very clear. Hey, if you, particularly federal grants, we're working with a US EPA grant now. If you, anything that you create and you share it, know that it's going to be shareable. So we're very cautious of what sort of stuff we include in our grants. So that's sort of my answer, Eloy or others if you want to chime in.
No, I completely agree. The key is to have resources available and preferably funding resources. We are a place-based organization, so we usually stay focused on the Pajaro Valley, but we do in our climate justice collaborative work, we work with partners across the region, and we are luckily enough to have that funded and have funding to compensate members of tribes to participate in that project. We try to, again, respect people's time and compensate organizations as much as possible, which isn't a lot, but something is something. We also work with a lot of the tribes feel like they're focused on their own work. So we go through kind of a medium. There's a local organization here called the Healing and Reconciliation Institute that works with a number of tribes in the area. So we've been able to partner them and rely on them to communicate with other tribal partners across this region.
And I would
Go ahead, Bonnie.
From California Air Resources Board, just that we're very interested in ideas for collaborative research projects and interested in collaborating with community partners and members of tribes. So we invite you to submit ideas for projects that we could consider and pursue if we have the funding. And we talked about the community air grants. And those community air grants, again, there's millions of dollars available, are open to nonprofits and Native American tribes. So there are grant programs through the Air Resources Board, and of course also the the climate investment funds. Are going through, again, many agencies, and are going to support projects in overburdened communities. And I don't know the exact amount, but I know some of that money is spread around across communities and tribal areas also. Lots of resources.
I would add, and communicate early. Don't wait till you have 2 days to submit a grant and say, hey, we'd love to include you. If you're even conceptualizing something, if you're thinking about something, let's think about where that money may be and include early. I mean, last minute requests, we won't take them anymore.
Agreed.
How about CDPH, Linda or Dan?
Yeah, thanks for the excellent question. We are cognizant that government has a long way to go to repair trust with tribes and a lot of reparations to make. And part of that is honoring tribal data sovereignty. It's tribes' data. They get to decide what to do with it, period. We do have a new tribal health equity advisory group that just started up. I had its first meeting on June 20th, and we'll meet bi-monthly. And they're just finalizing their charter, but they will provide guidance to CDPH's programs and services on effectively meeting the needs of the tribal community in California. I believe one of their projects may be a tribal data sovereignty policy, but I'm not aware of the details. And then we also have our local assistance unit, which maybe Dan is quicker on his fingers than I am, can put our local assistance unit email in the chat to request technical assistance on the part of tribes. And while we don't have staff or resources dedicated to CBOs, community-based organizations at this time, unfortunately, nor grant funds to get out. We would love to support collaborations between CBOs and tribes to address the health and equity impacts of climate change.
If I may put a plug into our efforts at OWIHA, our Indicators of Climate Change report has partnered with tribes to document the impacts of climate change that they've been experiencing for the first time in the fourth of 4 editions. Not till the 4th edition were we able to move ahead on this. We have contributions from 8 tribes describing how they've been impacted by climate change. And we also included information from tribes that participated in 3 different listening sessions. A total of over 40 tribes provided input into our 2022 report. We hope to continue that tribal engagement process. In fact, we're excited to work with Miguel in a short report on his tribe's climate change story. We also do adhere to the principles of indigenous data sovereignty. We make it clear to the tribe that they have the right to govern the collection, use, and distribution of any information relating to the tribe. Even if we have a draft report that has been prepared with the tribe, we do not share any portions of that draft without the explicit permission of the tribe. So just a little word on that. Let me see. Does anybody have other points they'd like to make on that question? I just want to save a few minutes to address the mental health question, because I think that's something that's worth noting. There was a question that was already answered in the chat, but I'm wondering, May, if you could just briefly elaborate on the mental health impacts of heat exposures?
Sure. So epidemiology study already find lots of linked heat or temperature increase with the mental health outcome. Our section published a study, and then recent years there's more and more study on concentrate on that. So far, the biological mechanism was not fully confirmed. It just linked to the hospitalization and the ER visit. We observed increased ER visit of those mental health outcomes, like insomnia and the mood swing, are like PTSD, depression, and especially we also examined the violent acts, including suicide and other violent acts, and then we found a significant increase. So that's kind of like a new thing, emerging evidence. So that's why we bring this to the public attention.
Yeah, and thank you, Linda, for your response to that comment as well. We have about 3 minutes left. So with that, I would like to thank this panel of speakers. Thank you all for your excellent presentations. I just want to again say thank you to our colleagues at the Department of Public Health and the Air Resources Board for conceptualizing and planning today's webinar, including helping us identify our great speakers from the tribe and the community, and May also internal in the family, OWIHA collaborator on today's webinar. So thank you all. And just as a final note, this is the 6th and final webinar in a series of 6 that we started. Actually, we kicked it off in an in-person symposium in January, as Dave Edwards notes or noted. This is a list of the topics that the webinar series have covered. Again, thank you to all of our co-conveners. The chat had a link to where you can access information about the webinars and recordings. And with that, yeah, we hope to connect again and keep this conversation going. So thank you, everyone.